Hey everyone, so let's get started talking about some psychiatric drugs. And the ones we're going to focus on today are benzodiazepines. So it's a long word for some drugs that do a pretty simple thing. Well, what do? Benzos or benzodiazepines, we call them benzos. If you're cool and you know your pharmacy, you can call them benzos too. They're used to treat anxiety. Well, let's talk about what anxiety is first of all. It is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Now, there's difference between anxiety disorders and actual anxiety. You can be an anxious person, but still be able to function in life. That's not a problem. I'd say I probably fall into that category. You can be anxious about things. It's a very typical response in life, but when those anxiety disorders begin to interfere with your daily life, your ability to do a job, your ability to go to school, that's when it's considered a disorder because it's actively interfering with your activities of daily living. So often anxiety can be managed without drugs. So what do? You avoid stressors, you avoid things that stress you out and make you anxious. Many people benefit from psychotherapy, talk therapy with a psychiatrist or a psychologist, meditation, yoga, or other complementary medicine systems, things to sort of center yourself and meditate and take things in, breathing exercises. Those can be quite useful to people with anxiety to sort of recenter them and make them less anxious. And of course, routine and lifestyle changes. If you're able to maybe stop drinking coffee if it makes you anxious, or plan things out better so you're not like procrastinating or doing stuff that's making you anxious because of certain things you can modify in your life, we try to do that. However, when a person is abnormally anxious for an extended period of time or anxious without cause, that's considered an anxiety disorder, and it falls under a wide net of possible disorders. Namely, we have our generalized anxiety disorder, or GAD. We have panic attacks or panic disorder, where people fall into panic attacks, sometimes without, they might have a trigger and then that could send them right onto the floor. Similarly, post-traumatic stress disorder is also classified as an anxiety disorder. That's better known as PTSD. It's very common with, especially with, say, military veterans who come back from a war zone. They may have had a traumatic experience, or due to prolonged trauma from maybe a rough childhood or a traumatic experience that someone has had at any point in their lives could cause PTSD. We also have obsessive compulsive disorder, or better known as OCD, and severe phobias. So phobias are an irrational fear of something that usually otherwise isn't too scary, or it's a fear of something that is completely out of their control, that is an overreaction to the actual probability of the threat, hence the anxiety disorder. So one of the things we can use to treat some of these disorders are anxiolytics, or anti-anxiety agents. Now, they're either used chronically or as needed to treat excessive anxiety. And here's the important point. Antidepressants are actually the best thing to use for anxiety disorders. So we're talking SSRIs, SNRIs, and some other antidepressants. They're preferred for the long-term treatment of anxiety. So that being said, benzodiazepines are preferred for acute treatment of anxiety. That is, they are used maybe in the instance of a panic attack, maybe someone's very nervous flying, so they'll take a Xanax before they go on the plane, or before a dental procedure or surgery. Benzodiazepines can treat multiple disorders and conditions, including alcohol withdrawal, agitation, anxiety disorders, insomnia. Even muscle spasms and certain seizure disorders can also be treated with benzodiazepines. However, what you see mostly with benzodiazepines is they're used for the treatment of acute anxiety. If someone is extremely anxious at this moment, maybe due to a surgery or maybe due to some traumatic event or a trigger for them, that's when you'll use a benzodiazepine, potentially on top of an SSRI or SNRI, to treat their normal state of anxiety. Now, benzos have the trifecta of auxiliary labels. If you remember anything about benzos, it's that they will have these three things all the time printed out on those auxiliary labels in the pharmacy. They may cause drowsiness. Benzos are known for being sedating. They may impair your ability to drive or operate machinery because of that. So they will lower your reaction time. They'll make you sedated, possibility of falling asleep at the wheel, which is quite dangerous, which is why we don't recommend that people operate any machinery or drive before they know exactly how these benzodiazepines may affect them. And then do not drink alcoholic beverages while taking this medication, because that can lead to an interaction between the benzodiazepine and alcohol. And that interaction can potentially cause a very, very low respiration or breathing rates, can cause issues with, I would say mainly issues with not just respiratory depression and breathing problems, but it would also enhance the effects of alcohol, and it may give someone a very, very rough time. Examples of benzodiazepines, they're quite easy to remember, actually, because they all of the generics at least end in the two suffixes, either PAM or LAM. So we have alprazolam or Xanax. You can see that right there. It's a very distinctive pill. Looks like a little rectangle. Clonazepam or Klonopin. All of these mostly are available as well as in concentrated liquids, which are quite good for people who may have problems swallowing pills. We have diazepam or Valium. That's sort of the go-to, I would say, before a dental or surgical procedure. It's quite quick acting. And it's also available in many different forms, including an injection, which is why it's sometimes used in ERs or emergency settings as well. Lorazepam or Ativan, available in a tablet, extended release capsule, disintegrating tablet, and again, a concentrated liquid. And midazolam, which you're probably most likely to see in a hospital setting, otherwise known as Versed. So because it's available IV or in a concentrated liquid, and it's used for a lot of minor surgeries for not just for that benzodiazepine anxiolytic effect or anti-anxiety effect, but it's also often used in anesthesia as well. And you see midazolam quite often prescribed in hospitals. Now, there's some more important notes on benzos. All benzodiazepines are C4 or Schedule 4 drugs. That is, that they have a potential for abuse, misuse, and dependence. And indeed, they're very common street drugs. They're very commonly abused. They're taken out of medicine cabinets, or they're not used for a dental procedure and they're sold on the street. They have a greater potential for respiratory depression as well when taken with opiates, muscle relaxants, and other neurological agents, because think about it, they're all working at the same time in the brain. The brain is responsible for respiration or breathing. And if you are taking a benzodiazepine on top of these other medications, which might also suppress the respiratory system, there is a possibility, especially when taken together with opiates and other neurological agents, that these medications might cause a breathing emergency. So that's why, at least in the case of benzodiazepines prescribed with opiates, so a morphine, fentanyl, we like to at least suggest to the patient or co-prescribe naloxone or Narcan, because that's recommended for concomitant opiate use. It's the opiate rescue medication. So if a person is having a breathing emergency where they stop breathing because of the additive effect of that benzo and that opiate that they're taking, then someone can revive them and get them to the hospital for the emergency treatment which they require. Now, benzodiazepines are also often taken as needed. So like before an operation, as I've been saying, they can be prescribed chronically, but generally we like to avoid that because of the extent of their side effects. As you can imagine, those side effects are respiratory depression and potential for pretty significant sedation. Others include memory impairment or confusion, again, because it's working on the brain, dizziness, and sometimes even slurred speech, depending on the dose. Now, oftentimes you can adjust the dose of the benzodiazepine to avoid some of these side effects. And again, use it sparingly to prevent any chance of an emergency or something, God forbid, going wrong. So that just about sums up our benzos for the day. If you have any questions, feel free to ask.